Now, every year, millions of people are affected by emergencies such as wars, conflicts, and natural disasters. And these crises are not only adversely affecting individuals, mental health has also been disrupted. Now, that is also something that is essential. This year on World Mental Health Day, the focus is on the urgent need to support the needs of people affected by humanitarian emergencies. Up next, we leave you with a special report. Do stay tuned. News and updates follow after a short break. Keep watching WION World is Fun.
War, hunger, earthquakes, floods, climate change, and a host of other global challenges may make it feel like the whole world is constantly collapsing into a humanitarian crisis. Crises such as natural disasters, conflicts, and public health emergencies cause emotional distress, with 1 in 5 individuals experiencing a mental health condition. In fact, being exposed to distressing news from around the world can also be very overwhelming, even for individuals who are not directly affected by the adversity.
When you are consistently exposed to traumas such as a natural disaster or a war, your body is consistently under that level of stress. And so, again, it's very hard for those of us who've never been in the midst of that to truly identify as to what that would even be like. But we can maybe, the best we can do is to try to relate to some of our own circumstances in life where we have constantly felt under pressure or trapped in some type of situation, whether it was, a hurricane or storm, and how we've coped in those kind of situations and the deep breathing that you can do. And again, trying to go within yourself to remind yourself that it's going to be okay.
Continuous aimless scrolling on the phone can negatively impact mental health over time, leaving one feeling uneasy and emotionally drained. World Mental Health Day is observed annually on the 10th of October. It serves as a global reminder to prioritize and invest in good mental health. This year's theme is Access to Services, Mental Health in Catastrophes and Emergencies. It highlights the importance of protecting mental health, especially during times of global wars and instability.
If you look at the crisis-hit areas, children are most vulnerable, then the women. And you know what happens in case of mental health problems, you need to fight it. You must have your own resilience. You must be able to sustain it. Now it is collapsing. You don't get services, you don't get help. Even your own systematic defense mechanisms, they are collapsing. Your sense of security goes haywire. So as a result, the physical morbidities are observable, they are manifested, but the mental problems which the population is going through is indeed, it's worrisome.
Every year, millions of people are affected by emergencies. Crises such as natural disasters, conflicts, and health emergencies cause psychological distress. Let's take a look at some startling facts. According to the World Health Organization, 1 in 5 people, about 22%, who have experienced war or conflict in the previous 10 years has depression, anxiety, post-traumatic stress disorder, bipolar disorder, or schizophrenia. 13% of conflict-affected populations have mild forms of depression, anxiety, and post-traumatic stress disorder, while moderate or severe mental disorders affect 9% of conflict-affected populations. People with severe conditions are vulnerable during and after emergency and need access to clinical care. However, emergencies disrupt mental health services and reduce the availability of quality care.
when you have this kind of flood situation, war situation, and this kind of critical situations around, so your social system is totally destroyed. So the child doesn't get that secured kind of an environment. Child doesn't have that self-esteem. So it's worrisome, you know, once you sit with these kind of problems, you don't know what to do. So the way out is all the schools should be made vigilant, should be given the access to the, the specialists' intervention, should not be hesitant about it. And most of the hospitals, private hospitals, are very expensive. I think it's high time you should let it be available in the primary health centers also.
Psychological scars of a crisis can endure for years, long after the physical wound is repaired. By investing in community-based interventions, mental health needs can be addressed to a large extent.
Mental health used to be a stigma, and it's so much less of a stigma now as people are coming forward and expressing the mental and emotional aspects of how trauma is affecting them and their lives and their families. So it's very important that if you are feeling physical symptoms, mental symptoms, that you can find the right help so that you don't have to suffer for eternity if you're not able to find the solutions on your own. It's very important to find the professionals that will guide you toward a greater sense of balance and well-being in your life.
If you have a healthy body, it can fall sick. If you have a healthy, intelligent mind, it can also have its problems. So that does not mean that you should not seek help. The earlier you seek the help, depends, your recovery depends on whether it is an acute onset or it's an insidious onset. The availability of the professional intervention definitely can address this issue very thoroughly.
This year's theme is a reminder that without mental health, there can be no true physical health. So the time to act is now. It is time to create a world where mental health is truly valued and easily accessible to one and all. Not just during emergencies, but at all times.